Okay, good morning and welcome to the webinar. This morning, we're delighted to announce our partnership with My1HR and their INSX Cloud quoting tool. Jim Riddell from My1HR is here to give us a product demonstration, and this will be followed by a Q&A plus our exclusive offer to Cornerstone brokers. And just so you know, your phones are on mute. If you have a question, put it in the dialog box and we'll get to it at the end of the presentation. Some information about Cornerstone. Group and individual, that's our specialty. Our licensing guru, Sandy Weber, can get you set up with whatever you need in the realm of appointments. We're proudly celebrating 30 years in the business, and we were just awarded for the 4th consecutive year one of the top businesses in Cincinnati. Here's my information. Okay, take a moment, jot that down. If you have any questions about marketing, about strategy, about quoting processes, the ACA, give me a shout. Here's Sandy's information. Please jot that down. And I do want to point out, please be sure you're signed up for the bonus program. Here's information on that bonus program. This is taking place during OEP, and this is for our carriers, the ACA carriers of Ambetter, Molina, Nat General, Oscar, and United Health, and soon to be announced Anthem. So during OEP, you can earn cash just by selling, and we think these benchmarks are very achievable. Sell 40, you get $500. And if you need to learn more about that, if you need to get signed up for it, give me a shout. There is a button on our website to get signed up for it. We've had great response already. I want everybody to sign up for this and take advantage of this great opportunity. Now, I also want to point out that you can earn cash just by referring business to us. What I'm talking about is the ASP program, the Agency Services Program. It's a great solution for your out-of-state markets, or just if you're too busy during 4th quarter and you don't have enough time to work a certain case. Just work with us. We can send you the referral link and you fill out the information, send it to our team. I can tell you more about that. So please give me a shout if you want to get signed up for the Agency Services Program. Okay, we're here to introduce our partnership with INSX Cloud through My1HR. And I'll go over this at the end of the presentation, but in a sense, you'll be able to sign up your clients for free, okay? If you are signed up with at least 3 carriers, and I'll go into more detail about that. And with that, I'm going to toss it to my colleague, Jim Riddell. And he's going to go over the presentation.
Good morning, everyone.
Great, I can hear you, Jim.
There we go. I'm going to share my screen in just a moment here. All right.
Okay, we see your screen. Great. You can maybe blow it up just a little bit. Okay, good. Okay.
Does that look all right to everyone?
On this end, it looks pretty good.
All right.
People can't see it, just give me a shout, send an email, or send a question in the question box.
All right, and I'll keep an eye on that too. So what we're going to review this morning, not just how to review an application or a quote, but some new things for 2019, some new opportunities that, of course, we've rolled into the same platform, and everything that we discuss here this morning is going to be available to you through the Cornerstone INSX Cloud. And if anyone's wondering the company name, we are My1HR. INSX Cloud is our broker product. So for you guys, exactly how you would access the platform, you're all going to have to make a determination. And this is something that when you get set up, when you contact Cornerstone to create your account, you'll be able to choose whether you need a branded platform or if you want to operate under their branded platform, under the Cornerstone branded platform. So if you're somebody who does operate under the Cornerstone branded platform, this is exactly what you would see. And don't be alarmed by the name at the bottom. This is a general link that you would all share. What's unique is your login. So when you log into the platform, you're accessing your own customer data. Each of you, again, would have your own unique login. And once we log in, you see that left menu expanded. So the view that we were in before is not what you want to use. You do want to log in to make sure that you're using your own account. And once we're here, there's going to be a home screen that you'll see changes throughout the year. During the special enrollment period, we're geared toward life changes and obviously SEPs. During the open enrollment, you'll see a new button here, a renewal button that will basically take you immediately to that customer's application. It's a simple name and date of birth search. But what we're going to look at today would be what we can do today. So an SEP enrollment is one application that we're going to go through, and another application flow is going to address some of those new opportunities with short-term medical and the ability to cross-sell other off-exchange ancillary lines of coverage. So to begin with, I'm going to use a quote that we've prepared here. So this individual, we've got a 38-year-old single male. We're capturing zip code, county, date of birth, tobacco status. If there are any dependents or a spouse, you click the plus button, it'll bring up a new line. This is where you add that spouse or dependent, plug in their date of birth, tobacco status. The minus button removes them. Pretty straightforward. And again, there's other lines of coverage. On this initial application, I'm just going to focus on that ACA medical policy. Now, be aware that everything on the platform can be written standalone. It can also be written more than one line of coverage on a single application. Whichever route you choose, it's still just going to be one application, a single point of data entry. So you will not have to enter duplicate information to enroll multiple lines. Now on the ACA medical, we do include that subsidy estimation. These are the same algorithms that healthcare.gov uses, so we didn't reinvent the wheel here. Something that's really helpful, maybe just a bit of broker-to-broker advice before you go to the marketplace and fill out that entire eligibility form, only to find out that the subsidy wasn't quite what you expected, and on a family of 5 or 6, you can lose a kid or two to Medicaid. Re-estimate this subsidy here before you've got too much time invested in the app. You can re-estimate as many times as you need so that we can figure out where that tipping point is before you invest the time in the eligibility app. So on a single individual, it's a little easier to kind of shoot from the hip and determine if they're going to be Medicaid eligible or if they're marketplace eligible. But we'll tell you right here in this line, might be eligible for premium subsidy. If we've got somebody who's below that federal poverty limit threshold, you get a heads up here that we might have a Medicaid and or CHIP application. So for the family of 5 or 6, if we're teetering on income, you can find out exactly where it is that all of the dependents are included in the policy. So when we do have that figure, we tell you where they fall on that FPL scale. We give you the subsidy amount. That estimated subsidy carries forward into the quote, so that when we're viewing the quote, we're seeing premium minus subsidy and then the member's net responsibility. Something to be aware of, the plans that you see on the Cornerstone platform are only going to be those plans that you work with Cornerstone. Now the links to look up providers and prescriptions, they exist all through those ACA plans. The same links that the carriers gave to healthcare.gov are the same links that we have here. So these provider searches will take you to that issuer website. Same thing with the prescription lookup, it'll take you to their formulary. And once we've selected a plan, we're moving forward into kind of a recap. And at this point, you have a completed quote, and you could choose to pick this up at a later date. You could choose to send this quoting link to the customer, which means they're going to see what you just ran for them. And essentially your plan selection will show us the recommended plan. Now, if you're ready to proceed with the application and you have a broker login and access to a unique side of healthcare.gov, when you click this green start application button, this is the first part of what they call the double redirect. It means that you're going to pass through to the broker side of the marketplace. You're going to access that with your CMS username and password. And essentially what you have is a master login for every application that you do. So for any brokers still doing things on the consumer side of the marketplace where you're creating usernames and passwords and you have to manage those, if there's a password reset, it goes to the consumer's email. All of that's out the window. You're using your CMS login to access every application, and this will work whether it was your customer last year, the consumer worked with another broker, or that consumer did their own application. It doesn't matter, so long as there's an eligibility application on the marketplace. You have the ability to use a name and date of birth search, view that application, and pull it back to the cloud. Of course, making any edits that might be necessary. Now, if they're truly new to the marketplace, it will let you start a brand new eligibility application. And what you will see is at the end of the eligibility app on the marketplace, it'll give you that same PDF with the results, same document you're already accustomed to. And at that point, once you have the results, it's not going to continue on healthcare.gov. It will bring you back to this Cornerstone INSX Cloud site. And at that point, you confirm the plan election and submit. With each enrollment, we do keep a record. So everything that you submit, you can view later. And this pertains to the on-exchange ACA plans, as well as some of these other products that we're going to look at here in a moment. But for each enrollment, you're going to have a record that we create. Give me just a moment to get back in here. And that record is going to show some customer contact information, their personal data, along with the plan that they chose. If we were talking about an ACA enrollment, it'll keep that app ID that healthcare.gov assigns and the writing agent. So all of this information is kept on every enrollment that you submit. And something, hopefully you don't encounter this issue, but it can happen if a particular carrier has trouble identifying you as the broker. Rest assured, it's not because of anything that you did wrong or anything that we did wrong. If you have the enrollment record here, that carrier has access to an application that has your broker information on it. Every time you submit an enrollment, we are embedding the broker name and the NPN without fail. It's an automatic process, and should you ever have a need for it, there's an export here that will generate an Excel file that would include all of that customer profile information, which in some cases has been helpful to kind of serve as an AOR or proof of the enrollment. And not to get too deep into that, but the point is you have the ability to pull that customer data from the system should you need it. Now, I don't see any questions just yet. We're going to transition from ACA to other off-exchange products that you have the ability to enroll here. But again, if anyone has any questions, feel free to submit a message, and we will answer those at the end here. Now, using the same individual, this 38-year-old single male down there in Hamilton County, we're going to take a look at the short-term and other ancillary lines of coverage. Short-term, this is an interesting piece. We've got some new legislation from a federal level that came out. That's probably been about a month ago now. They're going to allow 364-day short-term policies. Sounds like a bit of an oxymoron, but you'll have access to them here on this platform as of October. We've got if I've learned anything working in the software world, is that when somebody says they're going to roll something out, typically those dates are soft dates. So we've got an October 3rd projected rollout on the 12-month short term. So I would be more apt to say that you'll see it the first week of October. Short-term medical, as of today, remains under the current 90-day limit, but again, that changes to 12 months come October, and you will have access to that on this platform. So if you need to write one today, there's a couple things to be aware of. 3-month policies, if you check this box, the carrier, in this case, we're going to be looking at National General, will actually reissue the policy every 90 days on your behalf. You do not have to be involved in that process. They will keep you as the broker, and your commission will go unchanged. Now, again, as of October, the selection here will include a 12-month option. And we chose a few different lines of coverage here, but beginning with the short-term medical, we're looking at a significant decrease in premium when compared to an ACA plan. So for the same 38-year-old single male, I wish I had been paying attention when we ran that medical quote, but the average premium is north of $300, and that was for 2018. So we'll see what happens in 2019. But the point is, on these short-term medical policies, it's likely that you're going to save greater than 60% of the premium, which leaves a lot of room for other product purchases. And to be clear, we're not promoting this for every ACA customer. This is specific to the guy who's getting a moderate subsidy or even no subsidy, who's relatively healthy. The biggest downfall is if somebody has significant prescriptions, especially something like a specialty drug. An insulin-dependent diabetic is not going to be a good fit for these short-term policies. They probably are still a prime ACA candidate. So for the consumer whom this is a good fit for, we're going to move forward with a short-term policy that has in this case, we'll probably take the richer benefit because we're only looking at $6 difference in premium to go from a $5,000 exposure down to a $2,500 exposure that's 100% beyond that deductible. So it's a true $2,500 out of pocket with a $1 million coverage period maximum. And again, not to gloss over that, the provider lookup that will take you out to the carrier site. Something to note, the National General network is the Aetna PPO network, so it is rather robust. And looking at some of these other lines of coverage, some things that will make the plan whole. So you've got another obstacle to overcome going with the short term. Somebody who was on an ACA policy that is a traditional medical plan, I think there's some inherent discomfort transitioning to something labeled as a short-term policy. Some of these other lines of coverage have the ability to kind of make that plan feel whole again. So in this case, though, we chose a $2,500 short-term deductible. These gap products are not for Medicare. These are accident and critical policies that are designed to offset some deductible exposure. And in this case, we've got a $35 premium on a plan that gives you $2,500 of accident and $2,500 of critical. These are guaranteed issue policies. There's no coordination of benefits. So if your customer gets in a car accident, breaks a wrist, winds up with a $1,500 ER bill, that's what they're submitting to NatGen. They will reimburse that full amount less the deductible. So in that case, they get a check for $1,250. And then the consumer is also submitting that to either their ACA plan or the short-term medical, and whatever discount applies, the customer could conceivably profit from a claim. And in each of these, we've got an increasing benefit coinciding with the increasing premium, but you can take that all the way up to $10,000 of accident and $10,000 of critical, $54 of premium. But we'll choose the $35 option that if the claim were an accident or a critical illness claim, would entirely offset that deductible exposure. Now looking at some other lines of coverage, there's discount dental products all the way up through traditional PPO dental products, depending on your customer's needs. The discount schedule, you're at roughly 50% on significant claims like a root canal or crown, $6.95 a month, not a whole lot of commitment there. And we've got DentaTrust products and Renaissance, who's the sister company of Delta. These products run on a 3-year increasing benefit schedule with no waiting periods to begin with. By the 3rd year, it's rather rich, $3,000 annual benefit max with a regular $180.50 benefit. But for this sample, we're just going to take the discount dental policy, and I'll show you a couple of other lines of coverage. Vision being one, VSP. These are about as strong as individual vision benefits get. Premium still under $20 on the richest plan. Even if you go with a 24-month schedule on the frames, these plans are nice enough to offer the contact benefit every 12 months. So really at that point, you're just debating between $10 or $15 copays with a less than $15 premium. The last line of coverage that I'm going to show, this is something you probably wouldn't pick if you chose one of those gap products. This would probably be in place of that gap product. So if the customer doesn't want to spend $35 on the gap, they can have an accident fixed benefit policy for $19. So I'm not going to choose that plan since we chose the gap. What we have at the end with the summary is a quick recap of everything that we chose. Short-term medical, a gap, and a dental and a vision policy. Now, that dental policy through Carrington, there is a one-time app fee. The broker sees most of that. So this total responsibility here is actually going to be $35 less for the following 11 months. So at $130 a premium, we've created a benefit package for this individual that has a $2,500 worst case exposure. We offset the accident and critical claims to cover that deductible in full. So if that claim happens to fall under accident or critical, this individual has a $0 exposure. We also included dental and vision, again, for $130 a month. Now the cost saving to the consumer is fantastic. When you're doing these applications and we're not choosing an on-exchange ACA plan, we're dealing with an application where we do not have to interact with the marketplace, which means that essentially we're just gathering the last bit of information that we didn't already gather on the front end quote, which is the full social and the address. This is the bulk of data entry on an application. So you can see it's not much information. And we will ask the dropout questions for those short-term policies so you get immediate feedback as to whether or not that consumer qualifies for a standard issue policy or if we need to go back and view the guaranteed issue policies. Significant points here: pregnancy, weight limits, and a 5-year look back on significant medical conditions. Again, if they have to answer yes to any of those, we will redirect you immediately back to the guaranteed issue policies so you do not have to restart the quote. Now, just like the end of a quote, we're confirming the plans that we've chosen in a final recap. Of course, at this point, you could still go back and choose different plans, but this is the end of the application. If anybody was running a timer there, going through product description, it's still an application that takes about 5 or 6 minutes. It's 100% contained to your Cornerstone INSX Cloud site. Something I can't do here that you will see on a live application is when you click submit, you're going to see the payment information immediately. So for the off-exchange ancillary products, it is a true A to Z solution. You never have to leave the website. You don't have to go anywhere else and fill out any other applications. Multiple carriers, multiple lines of coverage on a single application. And again, just like that ACA app, we will track the enrollment. Everything that you submit, we keep record for each and every one of those lines of coverage. Now, I think at this point, we've covered most of the things that we wanted to review. Do you guys have anything else that stands out that we should cover before I give the reins back?
Well, I do want to point out, I want to emphasize your ability to track these ACA policies. That is enormous. So often there's something that needs to be fixed on the back end. We need to get something reattached. And our experience, we've used this, the past 4 or 5 years, and we've been able to get stuff straightened out just like that, just by this enrollment screen you're showing, particularly with the ACA carriers. We've got proof. So
sure, I'll give a little anecdote there. We had a broker who the administrator in the office inadvertently created his account with another broker's NPN. So the guy went through the entire open enrollment submitting under someone else's NPN and didn't get paid for anything. At the end of the open enrollment, he discovered this, and he actually just exported his enrollments from the cloud, and 4 out of the 5 carriers he wrote with actually accepted that enrollment export as kind of a mass AOR. So yeah, we've seen that be tremendously helpful to a lot of brokers.
Are we ready for some questions? You ready, Jim? So the first one, having to do a short-term, well, you have other short-term plans. Short-term on this platform right now is National General. Unfortunately, Cornerstone doesn't have the wholesale contract with Medical Mutual. Medical Mutual is no longer using GA, so unfortunately, we don't have the ability to do Med Mutual. But again, they have a very user-friendly platform, and basically, it's the same technology as Cloud here. So, you know, if you're using Med Mutual, you'll be very familiar on how their short-term works when you use this Cloud product here. Now, Anthem, they're coming back into the Ohio market, and indeed, we're looking at adding their short-term product. We should be doing something with their short-term product. Now, at the present time, Golden Rule UHC doesn't use this Cloud platform. They're using their own technology. And again, Golden Rule, I'm very familiar with it. If you have any issues with that one, you can certainly call me and I can walk you through that. But at some point, we're hoping Golden Rule does join this Cloud platform. But the next question is this available for short-term between jobs, not ACA by any means? Well, absolutely. Short-term can be written anytime, under any circumstances. So, and new legislation is being passed by the state of Ohio on how they're going to interpret the federal law, and we should have an answer to that in a couple of weeks. And hopefully it's going to be 364 like it is in other states. And Jim, do you have anything to add to that?
Well, we do have some unofficial preliminary information that it looks like things are going to go well for Ohio. And the other thing I didn't mention, not only do we have the extension of the short-term medical, but we've also got the waiver of the individual mandate tax penalty for tax year 2019. So there's a portion of the savings that was kind of eaten away by that tax penalty in years past. That's no longer the case. And if you have to write a short-term policy today in reference to that tax penalty, it's prorated. So your customer is not going to get dinged for all of 2018 if they buy a short-term policy now and opt out of the ACA. So for the remainder of 2018, tax penalties are prorated, and in 2019, they're non-existent. So.
Okay, great. So reiteration, the short-term carriers that are included in this INSX Cloud platform, National General, and soon to be Anthem. It's too early to announce that, but I'm optimistic that we'll be adding the Anthem short-term to this too. And the next question is, how do we contract with the non-ACA plans? Well, send Sandy Weber an email, and I can flip back to that screen if you'd like, and at the end of the presentation I'll do so, and she can get you set up with any non-ACA carrier. Now I do want to point out we do have a dental carrier on this platform. It's Dental Care Plus. Their product is called Dentamax, and so I think Jim's presentation showed a different carrier, Carrington, but I assure you that Dentamax is a terrific carrier, and they do a great job, and everybody is down here in the Cincinnati area is familiar with Dental Care Plus, their parent company, and they're expanding throughout the state of Ohio and Kentucky. So now I do want to point out this exclusive offer that we have. Jim, can you toss that back to me?
Sure.
Okay. All right. So again, this is very important. All we need are 3 carriers, and the fees for this cloud technology are waived. So this will save you hundreds, if not thousands of dollars. So if you have 3 carriers with us, the fees are waived. And please reach out to my colleague, Eric Pouncey, there's his information, epounceyjr@crnstone.com, and phone number is 629-2396. And here's my information again. And once again, I want to point out Sandy's email address, sweber@crnstone.com. And I certainly want to point out that we have looked at several different quoting and enrollment platforms. This far and away was the best technology. I think the strength of this product is the simplicity. Other products will just load you with lots of whiz-bang kind of interactive stuff, and you know what I'm talking about, just overwhelming your experience and actually, you know, confusing you. This is the most simplistic, streamlined process I have encountered, and they're a terrific outfit to work with. So we encourage you to give this a try. And if you need a personal walkthrough, if you have any other additional questions about this product, please reach out to me. And Jim, do you have anything more to add?
I do not.
Okay, everybody will get a copy of this presentation. And with that, I think we'll conclude the presentation. And want to point out, in the coming weeks, we do have some more items for you to take into consideration for the webinars. We've got Molina coming up on the 26th. I mentioned Dental Care Plus. They're going to be on next week, the 19th. Oscar, Anthem, Molina. These are all coming up in the next few weeks, so please look for your emails and get signed up for these additional individual corner webinars. And I think that does it for today. I appreciate everybody for joining us. And once again, thank you to Jim.
Thank you.